daily. And then the case rate is 3.4 per 100,000. Vaccination rates, we are at 61.8% of Sacramento County residents have received at least one dose, and 52.9% are fully vaccinated. So we have definitely made a lot of progress, and June 15th was the date that was set by the state for us to retire the blueprint. So we are beyond the blueprint right now, and the major changes are that there is no more requirement of social distancing and no capacity limits for facilities. And for those that are fully vaccinated, they do not need to wear masks indoors or outdoors, except in certain settings such as healthcare, jail, homeless shelters, public transit, and schools. We are still waiting for an update to the school's guidelines. And when that is made available, we'll definitely be able to give that to the schools. So with that, I'll turn it over to Dr. Cohen.
Hi, everybody. Welcome once again. And I again thank Sacramento County for inviting me to speak. I'm a professor of medicine and chief of the Division of Infectious Diseases at UC Davis. And we have seen a slight decrease in the number of cases compared to a week ago when we were on this call, but it is still not really going down. It's still staying sort of flat. So we're down to under 10% of what we were at our peak, but we are still higher than we were in March of 2021 or 2020, excuse me. And so there are still cases that are rolling in, and there are still people who are really sick. A third to a half of our patients are still in ICUs. And so it's nice because a lot of what we're talking about at the medical center is how we can open things up, what we can do. Can we start opening the cafeteria? Are there places where vaccinated employees don't need to be masking? There are a variety of issues that we have been discussing, but in the background is this idea that, in the words of Yogi Berra, it ain't over till it's over, and it's not over yet. And so we just still have to work. And that's part of the reason I really enjoy being on these calls is I think, you know, the way to end this pandemic is to get everyone vaccinated. And we are hitting a plateau here in Sacramento County, just like we are in the country. And even in clinic this morning, I had a couple of people who have not been vaccinated, and they can't really define why they don't want to be vaccinated. It makes it a lot harder to discuss and address some of their concerns when it's just, I don't want it. But I think we have to figure out more creative ways to get people interested and enthusiastic about getting done. And one of the things I fear in opening up everything is that people do think it's all over. And right, restaurants are open, we're happy, right? We're happy for the businesses. I feel terrible. I ordered so much stuff by mobile delivery this year to try to support local restaurants. Right, I'm lucky I don't weigh 500 pounds at this point. And so it's right, but I think we really have to be thoughtful about this and try to get our friends and family who aren't vaccinated vaccinated.
Great, thank you, Dr. Cohen and Dr. Kay. All right, so we have a smaller group today, which means that we have the opportunity to really dig into your questions. So don't hesitate to submit them through the Q&A. Okay, so our first question is, I can locate the COVID positivity rate for Sacramento County and other California counties, but where can I find positivity rates for the Delta variant in Sacramento and other counties?
On our dashboard, we do have information on the variants that have been reported to us, but we don't have it in rates because the numbers are still relatively low. So it's under the lab testing tab. So it shows you the number of variants. We are not doing rates at this time for the variants.
Dr. Kassirier, are these, how up to date are these? How quickly do you turn around the isolates to get them tested to identify variants? Is this up to date today? Is this a week behind because of the process of identifying the variants? Do you have a feel for that?
It does vary a lot because a lot of the genetic sequencing that is done is for surveillance purposes. So some of the labs are taking either a certain number of samples or all the samples they get and take them in for sequencing. And so it's usually comes way after the person, has, and oftentimes has already recovered. So it's not really used for us to be able to manage the patients. It's just more of a surveillance tool. I think the state is working on trying to develop a system where we can expedite that. In certain cases, they will expedite it, especially when we're dealing with an outbreak. But there is a considerable delay with getting results.
Yeah, that's why I brought this up, because I think that when you look at those bar graphs, it may be that given the rate of spread of the Delta variant, that as we sit here this very second, that bar may be longer than it is in comparison to the others. I just wanted to point that out because it does take time, and at this point there's no real, even if we knew in real time what the variant was, there really are no therapeutic changes. The management is going to be the same regardless of what strain of SARS-CoV-2 that somebody has. And so until we have something that would allow for differences, for example, if we were going to give a monoclonal antibody that wouldn't be active against one or the other, there really isn't the burning need to get this done in real time.
That's
Got
correct.
it. And I think that ties nicely into somebody's question here. So maybe just reiterating some of that information, which is the Delta variant was in the news this week. Should we be especially concerned about the high contagiousness of this variant? It seems there are more fully vaccinated Americans testing positive than in the past. Is this due to variants?
Yeah, go ahead.
No, I'll add on after you finish.
Yeah, I was just going to say that, I do think it's important. I think that, one of the things that at least is thought to have contributed to the big spike in number of cases that occurred in Los Angeles over the winter was the emergence of this so-called California variant, which I don't remember what Greek letter it has. It's probably it's beyond Delta and before Lambda. I'm not sure which, but But that variant was associated with a significant increase in transmission and therefore a more explosive outbreak in LA. And we've also seen how this variant has acted in India. And I grant you, it is going to be slower when people are vaccinated, because it does appear that the vaccines that we're using are active in preventing transmission or preventing at least severe infection with this variant. But I suspect that it still poses a risk, and that's why getting everybody vaccinated is important. And I don't know that we know specifically that this is the reason that the breakthroughs are going up, or whether it just happens to be because we're further out from when people started getting vaccinated. Right, it'll be important to figure all that stuff out. But at this point, at least I'm not aware of any data in relationship to that.
I think the data is still being collected on that. We have had some cases, but the numbers are still low, as you've mentioned. I think the concern for us is that we do have some pockets where the vaccination rates are concerningly low. For example, when we look at the zip code data for Sacramento County, we do have some zip codes that are at 90 plus vaccination, at least one dose. And then we also have some zip codes that are still in the 30s. And we find that people who are not vaccinated tend to be in certain communities. And so it is concerning, because if you were to get that, an outbreak in communities with low vaccination rates, then it could spread quite a bit. So we definitely are watching it, and that's why we're continuing to encourage people to get vaccinated. Overall, our numbers are getting better and better, but we also need to look at those communities that have low vaccination rates and try to get those numbers up.
Do we have the numbers for those who were positive for COVID, and how many of those individuals are under the age of 12?
That information is on our dashboard. We have it by age group. Sorry, Liz, if you can pull it up again. So under demographics. So you do have cases by 10-year age group. So it tells you, and I think you said under, what age was that? Under 12?
Age of 12.
12, yeah. So we do group them by 10-year age groups, so that it makes it easy to interpret what you're seeing. But this is what we have right now, and the numbers, especially when the schools were open, we were seeing an increase in cases in that 0 to 19 group.
Do you foresee public servants being mandated to get a vaccine with medical waivers for those who can't, like San Francisco is doing after the vaccines are fully approved? It seems like public servants should be vaccinated and not spreading COVID in the community.
So I can speak to the University of California, where it will be mandated. There will be medical waivers, there will be religion waivers. And we will be managing people differently, at least within the hospital, because once people are fully vaccinated and the rates of COVID have gone down significantly, and the health departments and California OSHA say it's okay for us to be practicing without masks, the people who are not vaccinated are going to still be masked, and they'll still be masked in every environment. Even now, once we're allowed to meet in rooms without masks, they're going to be masked. And so we do the best we can do. I think it's hard to make it an absolute mandate, although you saw Methodist Hospital in Houston did, and has actually terminated some people who have not been vaccinated, and they were taken to court, and they actually won. The hospital won. So I think I don't think anyone's looking for draconian stuff. We're trying to make it such that people are thoughtful, and exactly what you're saying. If you're front facing with the public, you shouldn't be putting the people who you're interacting with at risk.
Well, I don't have anything to add to that. What I can say is that the state right now is not considering any mandate, but of course, as we progress, as Dr. Cohen mentioned, we'll see what happens as with the cases that are coming up, and with the groups that we still consider vulnerable, and seeing how to best protect them.
From a psychological standpoint, why do you think that so many people are still in so much denial over how serious COVID is? The ones that refuse the vaccine and say that the death rate isn't that much.
You know, I wish I had an answer for that, because I find it perplexing that even when people are faced with all of the evidence, that they choose to not believe it, or will twist the information to fit what they want to believe. I think in public health, it's a battle that we have to continue working on, being able to build that trust, and be able to make sure that the information, the correct information, is out there, so that people can make informed decisions based on facts.
If I can make just a couple of comments, which are more my own feelings, so I will say Sac County has nothing to do with what I'm saying now, but I think first off, the mortality rate is comparatively low, but it's so transmissible, it's so easy to get, that it still has killed over 600,000 people in the United States, right? That's not trivial. That's the size of the city of Sacramento, right? Entirely being wiped out, plus probably a little bit of Folsom or Roseville. And so, that is not minor. I'm an old man, and I started doing infectious diseases at the beginning of the AIDS pandemic. And that seemed to me, and maybe because I'm only that old, it seemed to me to be the first disease that I can remember that was a totally political phenomenon, where everything about it was politics. And the decisions that were being made were not all based on medicine. They were based on social concerns and other kinds of things. This is different because it doesn't require active behavior to get infected, but nonetheless, this has been politicized from the beginning. And I think that once you get people off on a tangent where they're not really listening to what's really happening, it's really hard to bring them back. And we've become a bit cynical about science. And it's obviously frustrating to all of us that actually really believe in what's going on. And the last thing I'll say is that today is June 24th, 2021. I think our first patient at UC Davis was February 23rd or 24th, 2020. So that is 15, 16 months ago. I am counting in my head, 16 months ago. And so if I'm saying the same thing today as I said then you shouldn't believe me, right? Because we've got almost a year and a half worth of information. So the idea that we weren't all pushing masks at the beginning because there were mask shortages and because we didn't really have all the data doesn't mean that now it's the wrong thing and that we were lying at the beginning, right? This is the problem. Science evolves. The information evolves. We try to provide the most recent info. That's why we do these things every week, and things change, and people have to understand that that's how science works. That's how medicine works. We talk about practicing medicine. That means that we don't know everything. I'll leave it at that. Editorial comment over.
All right. Thank you, Dr. Cohen. So, do we anticipate that COVID might eventually run its course and die out, or will it stay around and continue to spread among those not vaccinated? Is there a public health plan in place for moving forward if a substantial portion of the population chooses not to get vaccinated?
In public health, that's one of the challenges that we always have to look at, is looking at what is good for the community as a whole, as opposed to an individual's rights to do what they want. With infectious disease, especially because what your actions can impact other people. Sometimes we do take additional steps, and you saw that when we took measures and issued orders to tell people to stay home, to tell people to isolate or quarantine. But again, we always try everything else first, anything else that's less restrictive before we go to something that's, like ordering someone to do something. Dr. Cohen has hinted at the frustration that we see, but I think we still are holding out hope that as we continue to work with communities and answer questions, that we'll continue to chip away and get as many people vaccinated as possible. I cannot say what would happen if things reversed and we started seeing outbreaks again. I think that will be heartbreaking for everybody. But right now, I think our goal is just to continue working with communities and hoping that we'll be able to get the numbers low enough that most people can be able to get back to their regular lives without masks. In the previous question, I think you asked about whether COVID will go away completely. I think in the conversations among the scientists, it seems more like COVID will be here, but we don't know how it's going to act. Is it going to be seasonal like the flu? Is it just going to have that background number the entire year? We don't know yet. We're all going through this for the first time together. So, and as Dr. Cohen said, our information evolves, our knowledge evolves, and so we continue to look to see what we can do to protect as many people as possible.
Yeah, I don't want you to get me wrong. I'm optimistic about this too. I really do think that we can get this controlled. I do believe that we have the tools and we have the willpower to do it. It's just that we really have to take it seriously and get the folks who are a little bit edgy about everything on board and try to figure out ways to make people feel more comfortable with the process.
So Jessica's reading that some states and counties are testing wastewater to track the Delta variant. Is that happening anywhere in California or in the Sacramento metro area?
Yes. But it's more on the surveillance as part of the surveillance process. So we're hoping that we'll be able to get some data soon, and they have let us know that they are doing some of that work in Sacramento.
Yeah, and they're doing the same thing on the Davis campus, on the main UC Davis campus. They've been collecting sewage for a while, doing trying to identify virus and identifying variants. So there will be a reasonable amount of information throughout the Sacramento metropolitan region.
Katrina works in South Sacramento, zip code 95828. Are residents there getting the vaccine? I'll go ahead and pull up the map. So here's the 95828 area.
Yeah, under vaccinations, and we do have some additional. Yeah, I guess this gives you a good idea of the different areas and the vaccinations. But actually, the last board update that we gave to the Board of Supervisors, we did provide numbers by zip code of vaccination rates. So if someone is interested in doing that, they can also access that information. It is on the Board of Supervisors website.
All right, I'll try to get you that Board of Supervisors website, Katrina, but I'll also send you the map as well that we just looked at. It doesn't sound like there are any new treatments being used clinically. Are there any in the pipeline?
Yeah, so treatment is evolving a little bit, and what I was saying is that it doesn't make any difference whether it's the Delta variant or the Alpha variant or the original virus. The treatments are the same for the most part. And let me explain just a couple of things, since I think we have a little bit of time. So the primary treatment that we use for hospitalized patients, the primary two treatments, are a drug called remdesivir, which is an antiviral drug that shortens hospital stay and probably does also decrease mortality rate based on some more recent data. And then for people who are on oxygen, they get steroids, they get dexamethasone. There are a series of other drugs that can be added to those that are also involved with the immune system that seem to add some benefit to the steroids. For people who are not quite as sick, that don't need to go to hospitals, the monoclonal antibodies, which again, people remember hearing about the Regeneron combination because that's what President Trump received. Those are still active even against the variants that we're seeing currently. There are some monoclonal antibodies that we can't use anymore because the variants have sort of made an end run around those particular monoclonals. And so I think that's the bulk of it. But there are oral treatments that are being developed that are antiviral drugs. There also was a study with the monoclonal antibodies used subcutaneously, sort of like people give insulin with shots that can be administered quickly and don't require an infusion center, that also appears to decrease infection in people who get exposed. And so there is movement forward. it's clearly not been as rapid as the vaccine development. And there are some things in the pipeline. Right now, we've been talking about trying to keep case rates down, and that's what we all want. But in order to test drugs, you need patients, and so that has also accounted for some of the slowing, and the development of these drugs are going to be sort of like every other drug. It just is going to take a lot longer time now because we're not able to enroll 1,000 patients in a month or in 2 weeks.
Dr. Cohen, could you, because this is a question that has come up from time to time to public health, could you address the use of vitamin D and ivermectin in the treatment of COVID?
Yeah, so ivermectin, for people who are not familiar with it, is a drug that's used for some parasite diseases, some worm infections. It's also sometimes used for scabies in particularly severe cases. And it has been tried, but the clinical trials demonstrate really no benefit for ivermectin. As far as vitamin D may play a role in helping boost the immune system. I've not seen any data that it's really impacted COVID outcome, but that's something that, as long as you don't take a ton of it and get toxicity from it, there's not a lot of downside. And it turns out that a lot of people, even living here in Sacramento, where it doesn't rain anymore and we have sun every day, there's still a lot of people who have low amounts of vitamin D in their body, and at least bringing it back up to normal will help. So I'm not saying to use it, but I don't think vitamin D in modest amounts is going to hurt anybody. I don't think ivermectin provides any benefit at all, either for prevention or for treatment.
Thanks, Dr. Cohen. I may not say this correctly, but David is wondering, what is the rate of myocarditis with the different vaccinations?
Yeah, so I can address that some. So CDC and the vaccine study group at CDC met earlier this week to talk about the myocarditis story. And so with the RNA vaccines as a whole, after the second dose, it's about 12 or 13 per million. It's a little higher with the Moderna vaccine than it is with the Pfizer vaccine. But if you look at it as a grand total, there are 26 cases total that they looked at in 12 to 39-year-olds. And there were 3.4 million doses given to get those 26 cases. 16 of them were with Moderna and 10 of them were with Pfizer. And the number of Pfizer vaccines was a little bit higher than the number of Moderna vaccines. So that's sort of the general number. So it's really, really small number, right? It's about somewhere around 8 per million is pretty small. The other thing is that when they looked at how sick people got, a significant percentage of people, I think it was 3/4 of them, actually required hospitalization. But hospital stays were really short. They got started on drugs like ibuprofen. Occasionally they needed steroids. There were a really small number of people that required being put in an ICU. But when you look at the comparison between what would be expected if all those people got COVID, the number of cases of myocarditis would be higher. The number of hospitalizations would be higher. The number of people in the ICUs would be higher. So even though this is a real phenomenon and it has made a lot of people nervous, I have gotten a lot of emails from the people that I work with in offices and other stuff about their kids and whether they should go forward with it. I try to provide them all the information so that they can make their own decision after I tell them that the risk benefit still says that you're better off being vaccinated than not. And so I hope that gives you sort of a number.
I think that provides a lot of great information around that question. Thank you, Dr. Cohen. So, bucketing up a little bit more broadly, David is wondering, what is the rate of COVID infection of those who are fully vaccinated?
I do not have that in hand. I know that CDPH did provide some information. I know it's something like to the order of 0.03, but if we can go on to another question, or if Dr. Cohen has information, go ahead.
I was going to say it's significantly under 1%, but I don't have the actual number. There are a bunch of zeros in front of it. Part of the reason that we can't give those answers as clearly is at least CDC, now maybe CDPH has a different strategy, but CDC stopped counting all the cases because it was getting to be too much work for people to do. And so they started counting people who were hospitalized and who died after getting vaccine. And again, it's got a number of zeros before a number percentage-wise looking at those folks. But it's pretty darn small, but it's not zero. It's not zero.
Got it. Well, if we do get the number, we can come back, David, and address that as well. Last meeting, I asked about the ability to get data for vaccinations of 12 to 18-year-olds by zip code. The answer I received was a bit unclear. I looked at the shared data. The county has an age range capture of 12 to 29 and vaccine data capture by zip code showing total percentage vaccinated in each zip code. Why can't the data for 12 to 18 and zip code be easily shared?
Sorry, let me see. I don't know if I'm still muted. It's because it's not an easy question in that the database that we're using is with the state. And so we have certain information that we're able to get. So in order to be able to link the zip code with the age ranges as you're requesting takes a little bit longer. And right now we are not doing it. So we're providing them separately.
Is there any reason to worry about the vaccine affecting development in 12 to 13-year-old girls?
That's an interesting question, which I'm not sure there's a clear answer for based totally on data. But let me tell you what is known and at least my thoughts. So what is known is that it doesn't affect fertility in women or young women. It does not affect fertility in men, and including sperm counts don't go down after people have been vaccinated. It doesn't affect placenta in pregnancy, and it doesn't long-term affect fertility. As far as development, and I'm assuming you're talking about going through puberty. I don't think anybody has looked at that information, but there's no reason to expect that it would. It hasn't affected any other problem or any other issue within the genital urinary tract of either sex. So I don't think there's any reason to expect that that would be the case, but I am pretty certain there are no data to state that.
And I do have some information here about the post-vaccination COVID cases. So between January 1 and April 28, there were 3,084 coronavirus cases in people who were fully vaccinated. And when you look at the number of people that were vaccinated, I think it's like 18 million, the rate is 0.024%.
Thanks for following up on that, Dr. K. And a follow-up question to the previous question is, could a vaccinated pregnant mom pass on immunity to her baby?
Yeah, I think that's one of the good things. Right, I think, you know, if you think about why childhood vaccines are given in the time frame that they're given, the reason is because the babies are born with antibodies from their mother, and so they're often protected for a period of time to allow their own immune system to develop to the point that a vaccine would actually work. So there's no reason, again, to expect that the antibodies won't cross the placenta, because antibodies do that. And so I don't know whether the concentrations of antibody would be high enough to absolutely protect the kids, but there will definitely be antibodies present as the baby is born.
Great. Should people who received Johnson & Johnson talk with their doctor about getting a Pfizer or Moderna shot to be extra protected against the Delta variant?
I would say at this point, no. And I'll tell you that at that same CDC meeting where they talked about the myocarditis, they also started talking about booster vaccines and when people are going to be thinking about boosters. And really that's sort of what your question is asking, because you could look at it the flip way too, as to whether they got Moderna and Pfizer, and whether they would need another dose of either of those or the J&J vaccine, which actually has been done in some transplant patients. And I think that at least at this point, there's no clear evidence that it's necessary to be giving boosters. I think the antibodies remain against the Delta variant. It'll be a little bit of time before we get more data regarding whether they wane more rapidly than the antibodies do entirely. But in reality, you know, when Pfizer looked at their information 6 months after people had been vaccinated, the protection rate went from about 94% to about 91%. So it's really not negligibly changed, to the point that it's not clear that a booster would add very much. As I mentioned, there is one small study that was done, I think, at University of Pittsburgh, but don't quote me entirely on that, where they looked at transplant patients who didn't develop antibodies to the Pfizer or Moderna vaccine, and they gave them a booster with the J&J. They gave them one more vaccine dose, and about half of them developed antibodies, so the people who didn't have antibodies before. And so there are going to be boosting strategies. I think people are looking at this now and trying to figure out how to roll it out. The one good thing is that we have ample vaccine right now in the United States, even though thankfully they're providing vaccine around the world in addition. And as many people may have seen, the Novavax trial also demonstrated a highly active vaccine, and hopefully they will be going for an EUA in the next month, and there'll be more vaccine, and that's a more traditional vaccine. So for the people who are just scared of getting an mRNA vaccine, that one might be the one to get them over the hump.
All right, so it looks like we have our last question here from Tony, who's wondering if we can refer him to a succinct summary, or refer them to a succinct summary of the vaccine effectiveness studies.
You know, off the top of my head, I can't. I haven't even given you a succinct answer today at all. And so I think one place to start is the CDC website. They have a lot of information on COVID vaccine. They have stuff for the general public in addition to medical personnel. But if you're actually talking about looking at the actual clinical trials that were published, a lot of times, even within the journals, they have small snapshots that tell you what that study added to what people knew before. And so that's the other way, is just Google these studies. They're all published in the New England Journal of Medicine, and I think most of them are open access because of the nature of the information that's provided, and they may have short summaries attached to those as well.
Okay, so Tony, I put a link to the CDC safety section on vaccines, and then Dr. Cohen mentioned the New England Journal of Medicine for the specific reports. All right, so those are all the questions we have tonight. We really appreciate you all coming to this conversation, asking all the questions that you have on your mind. As mentioned in our last COVID community conversation, we will be meeting again not until the end of July. And so we'll update the Zoom, so you'll get a email that says that next date, as we kind of assess what the community continues to need around COVID and COVID information and community conversations. Dr. Cohen, I'll start with you. Anything you want to add before we exit, and then we'll go over to Dr. K?
No, just thank all of you for attending and maintaining interest, and being great advocates for the folks in our community. It's much appreciated.
Well, same here. I just want to thank you for spending this hour with us. And we continue to hope that this information is helpful, and that this is a way for us to be able to interact with the community and answer questions. So hopefully we've been able to achieve that. And if you have not been vaccinated yet, please get vaccinated.
Awesome. Thanks, everybody. And if you have questions in the interim, I'll just go ahead and put our county email, where you can ask questions about the vaccine. So you can always engage there. Throughout the conversation, I put information about our dashboard, where you can stay up to date on all things relating to Sacramento County. Thank you. Bye.